There are a lot of fillers on the market. There are permanent fillers, there are semi-permanent fillers, there are more commonly used temporary fillers known as the hyaluronic acid-based fillers. I personally like to use the hyaluronic acid-based fillers. This includes Restylane, Restylane Silk, Restylane Lift, Juvederm Ultra, Juvederm Ultra Plus, Juvederm Voluma, Belotero, and there's a lot of new ones coming down the pipeline as well. The benefit of using these temporary fillers is that they're not permanent. So what looks good right now might not look good 10 to 15 years from now as your volume in your face begins to change. Because there's so many different fillers with so many different properties, they can be customized to different areas of the face. Now, every injector is going to have his or her preference for which filler that he likes to use or she likes to use, and they can give you that information when you come to that visit. An area that we're commonly asked to perform filler injection is the under eye area. I like to use Restylane in that area because it doesn't tend to pull in as much volume as other fillers. It's also a thinner filler, so it's less prone to having any lumpiness in that area. You can also use Restylane in the medial folds, also known as the nasolabial folds, as well as the marionette lines down here and other areas of the face, but it is my favorite filler when I treat the tear trough area. When it comes to the cheeks though, you want to have a thicker filler that has more cross-linking. The benefit of that is it's going to last longer and provide a greater lift, and the skin there is a lot thicker. The two that I like to treat in that area are either Restylane Lift or Juvederm Voluma. The benefit is they are longer lasting and do provide for a longer lift. I don't like to use those thicker fillers in thin skin areas, such as the tear trough, or in some of the finer wrinkles you get around the face. I like to use Restylane Silk in the fine wrinkles frequently found around the mouth there and other areas of the face. Because it's thin, it can be injected more superficially. The drawback is that it doesn't last as long as some of the other fillers, but again, it can be used in other areas where some of the thicker fillers might show up, be more visible, and give sort of a lumpy appearance. I like to use Juvederm Ultra or Juvederm Ultra XC for the mediolabial folds, the marionette lines, and to add volume to the lips. The reason is that it does tend to pull in more water in my experience than Restylane does, and it helps to add a little bit more volume to those areas than my Restylane injections. And so that's why that's my preferred treatment there. When it comes to the lips, the two that I like to use are either Restylane Silk, which really helps more with the fine lines on the lip, and then Juvederm Ultra XC, which adds more volume to the lip. So depending on what your goal is with your treatment, you can go with one of those. When it comes to other areas around the face, really it's customized to what the particular issue is that we're looking at. And the fillers can be interchangeable, but we're able to use the properties of the individual fillers to give the best result for that particular area. And again, these are my preferences, and your injector might have something different. And it's important to discuss what he or she prefers to use before your injection proceeds.